Yeah, thanks for your company on this beautiful Monday. Yes, the 18th of May. May's flying, isn't it? Not long now before the Barunga Festival. Anyway, I have a special guest joining us in the studio, Mr. Salimon Joseph from Territory Hearing. He's here to have our regular little chat about all things audiology. So over the last couple of weeks, we've been speaking about the inner ear, the middle ear, and now we're going to speak about the outer ear. And we have spoken about the difference between actual physical ear health and also your hearing side of your health. So the outer ear.
Absolutely, excellent. Thank you very much, Brendan. And as you correctly pointed out, we will be talking about the outer ear. So, as you know, the ear has got three parts: outer ear, that includes the pinna, and then the ear canal, and then the middle part, that is the middle ear, and the inner ear. So today we will be highlighting about the outer ear. So the pinna, the function of pinna is to funnel the sound to the ear canal. So in audiology, the measurement of sound is in decibel. The role of pinna is, you can see the different grooves here. Even in our ear, the pinna has got different grooves that funnels the sound into the ear canal. Through that funneling, we are getting additional 3 dB increment. 3 dB is in decibel is doubling the intensity of the sound. So that much increment we are getting. And then the sound is passing through the ear canal. In the ear canal, at the entrance, at the cartilaginous part of the ear canal, there will be wax or cerumen, the secretion of the cerumen. It has got mainly 3 purposes. It has got a bit of offensive smell for the flies. So it will like a guard, preventing the flies getting into the ear canal and making their house inside the ear canal. So it will work as a deterrent for the flies. And the other thing is the wax will work as a lubricant of the ear canal. And the other most important thing is the wax, the pH value of wax is around 4 to 5 positive. That means it is acidic in nature. So when microorganism, fungus or bacteria getting into the ear, it will kill those microorganisms. If it is a small amount, if it is too much, then it cannot, then it will become an infection and stuff like that. So these are the basic stuff. But you will see in your lifetime, sometimes the children born with no pinna, that is called microtia. So that need to be fixed through surgical intervention by ENT specialists, and sometimes plastic surgeon also need to be involved in that one. The microtia, sometime only the pinna is missing, the canal is fine. Maybe sometime the middle part of the ear also may be fine. The inner part, inner structure also may be fine. But some cases the ear canal may not be fully formed when the baby is in the utero. So there need to be surgical intervention in that particular case. And the role of the infection. When we talk about the infection in the outer part of the ear, mainly it happens in the ear canal, where otitis externa. In Northern Territory, a lot of people having otitis externa. That means infection in the canal. And when you look through the otoscope, you will notice that it's swollen. There is discharge coming out from the ear, and it need to be treated. You need to see your doctor. And generally, if you search on Google in the AA mode, you will realize that it's a combination drug, antibiotic and steroid combination. That is a medication needed for otitis externa. It has got a mild form and then a very severe form. And other noticeable thing is the skin issue, eczema type, the peeling of the skin in the ear canal. That also need to be talked with your doctor, and there is medication for that. Naturally, if the skin in the ear canal is intact, and normal texture, what will happen is the wax will naturally come out by itself.
So sometimes the ear will actually clean itself.
Naturally, that is a mechanism. Our human body is a fantastic super mechanism. And as I was talking, even the wax has got some purposes, and the wax is sitting at the entrance as a guard to protect the ear. So we have to have appreciation of our human body, and we have to treat our human body in a friendly manner. Okay, always listen to the body.
Yeah.
If there is any problem, ear problem or hearing problem, you need to see the right professional, and you need to know it is our responsibility. The healthcare, looking after our health, is our responsibility. The state may be providing health clinics and other things, but we have to make an initiative to do something about it. No one will come and rescue us,
Yeah, and I think one of the main things also is not only with audiology and your hearing, but anytime you do have an issue with your body, do not freak out. Take time to, don't stress about it, and actually go and get it checked out, because it might be a lot less than what you think. So you've just spent all this time stressing yourself out only for it to be a minor issue.
Absolutely. And the other most important thing as far as ear wax is concerned, ear wax is a protective thing. Little bit of ear wax is always good for our ear health. But in today's life situation, the lifestyle problems, we brought so many problems due to our lifestyle in today's world. One of the problem is the people who work in a noisy workplace, or a lot of tradies, okay, plumber, electrician, and all these people working in noisy place, they use earplug. When they use the earplug, just use the earplug and put deep into the ear canal. The plug may be going that far. Through that, okay, inserting their main objective is to protect their hearing by avoiding very loud sound. But actually, what they are doing to the wax is they are pushing the wax further into the ear canal. And the youngsters, when they listen to music using their AirPod, they are also doing the same thing. They are pushing the wax further into the ear canal, and over a period of time, the wax will accumulate closer to the tympanic membrane or eardrum, and they will feel a blocked sensation. Then you need to see a trained audiologist who can do microsuction, and we can suck it out.
Yes, because sometimes that can be the issue of you might be thinking, I'm losing my hearing, but what it is you've actually pushed the wax back into your ears, whether that's pushing earplugs in, pushing headphones in, or maybe you're using a cotton bud to actually push the wax back in. So sometimes we need to do the, what's that called?
The Valsalva maneuver.
Valsalva maneuver, to just kind of clear your ears out, because sometimes I used to do that where it's like, oh no, I'm having a loss of decibels in my hearing, you know what I mean? But then it's been a simple case of just blowing my nose, and then all of a sudden it's like, wow, okay, yeah, my ears are clear.
The Valsalva maneuver will help us to unblock the middle part of the ear pressure. So generally it will not help you for the wax management, the middle ear pressure.
Yeah.
So the role of the eustachian tube in the middle part of the ear is to equalize the middle ear pressure. So during takeoff and landing on a small plane or big plane, we all notice the pressure difference in our ear, because the cabin pressure changes significantly compared to the middle ear pressure during takeoff and landing. And what we do, we sip a little bit of water, or we do the Valsalva maneuver, close the nose, as Brendon said, close the nose and blow the air, and then the eustachian tube will be open up and it will equalize. And you all notice that during takeoff and landing, if there is a baby sitting with the mother's lap, they will start crying because they cannot do Valsalva maneuver, and we cannot give a lollipop into their mouth because they will suffocate. So the smart mother, what they do, they will breastfeed the baby. As soon as the milk is in the mouth, every baby in the world will swallow. That is a natural response. And each time when they swallow, it equalizes the middle ear pressure. So the mother only need to do during takeoff and landing, because when the plane reaches certain height, like 30,000 feet or 25,000 feet, the cabin pressure stabilizes, and there is no pressure difference at that time. So that is applicable to people who does the scuba diving.
Yes.
I get a couple of clients each week or during the month, that whenever they go to our neighboring places, the other countries, when they do the scuba diving, and if they are not listening to their body, suddenly they come up, it will bar trauma. It can create problem in the middle part of the ear, and sometimes it can create bit of permanent hearing loss too. So even people who do the mining work underground, they also experience the same thing. Okay, the human body is designed in a normal way when we are above the surface of the earth. If we go up or down, the pressure varies, and then we have to adjust the middle ear pressure using simple tactics.
Yes, it has been very, very interesting. Thank you so much for having a chat with us. Now, if people are in the Darwin Palmerston area, maybe the rural area, they can head along to Territory Hearing, which is in Farrer. Muirhead. Okay, yep. So if they do need information, we can give them the address, maybe the phone number, and they can head along and get their hearing checked out, and maybe even the kiddies too, because sometimes, the old, I know you can hear me.
And now it's very mandatory in many schools that when they join the school, they need to have an eye test and hearing test.
Hearing test, yes.
Yeah, to rule out.
Because they are one of the most important things, because especially hearing too, with understanding and learning language, culture and all that sort of stuff, comes in very important, especially to get the message, which is hearing. Anyway, thank you, Mr. Joseph, my brother.
Thank you.
It's always been a pleasure. We could chat for days. We could chat all day, actually. But I know you're a very busy man. You have very important things to do, so thank you.
Thank you very much, Brendon. It's a wonderful opportunity. Thank you.
Go.